You might have heard of ADHD, but what exactly is it? ADHD stands for Attention Deficit Hyperactivity Disorder. It's a condition that affects both children and adults, though it's often first noticed in childhood. It's not just about kids being a bit boisterous. It's a recognized medical condition that affects how a child's brain works. Think of it like their brain's control panel, having a few loose wires, making it tricky to focus and control impulses. This can lead to challenges in school, at home, and in social settings. Here in the UK, ADHD is more common than you might think. Experts believe it affects about 3 to 5% of school-aged children. That's roughly 1 or 2 children in every classroom. And while it can affect anyone, it's more often diagnosed in boys. Boys are more likely to be diagnosed, but girls can have ADHD too, often with different symptoms. Now, every child is unique, and so is ADHD. There's no one-size-fits-all picture, which is why it can be tough to spot. Some children might be hyperactive and impulsive, while others may be more inattentive and daydreamy. But don't worry, we're about to break down the signs and what you can do if you think your little one might be struggling. Understanding ADHD is the first step in helping children manage it effectively. Stay tuned as we explore the signs, symptoms, and strategies to support children with ADHD. We all know kids have boundless energy, right? So how do you tell if it's just normal kid behavior or something more? Well, children with ADHD often display certain behaviors more frequently and intensely than their peers. These behaviors typically fall under 2 main categories: inattentiveness and hyperactivity impulsivity. It's important to remember that not all children with ADHD will have every single symptom. Some might be more inattentive, while others might be more hyperactive. Let's dive a bit deeper into each category to understand the specific signs you should be looking out for. Remember, this isn't about labeling your child, but about getting them the support they need to thrive. Imagine this. You're trying to have a conversation with your child, but it's like their mind is somewhere else entirely. You ask them a question and they respond with a blank stare or a vague answer that makes it clear they weren't really listening. It's as if their thoughts are floating away on a cloud, far removed from the present moment. Sound familiar? Inattentiveness is a key characteristic of ADHD, and it can manifest in various ways. For instance, your child might be physically present in the classroom, but mentally miles away, lost in their own world. Your child might struggle to pay attention to details, making careless mistakes in their schoolwork. They might rush through assignments, missing crucial instructions or skipping steps, leading to incomplete or incorrect work. They may seem forgetful, losing things like pencils or homework assignments. This forgetfulness can extend to daily routines, making it challenging to keep track of their belongings and responsibilities. Staying focused on tasks, especially ones they find boring, can feel like climbing Mount Everest for them. Even simple tasks can become overwhelming when their mind constantly wanders. It's not that they don't want to pay attention, it's that their brain has difficulty filtering out distractions and staying on track. The smallest noise or movement can pull their focus away, making it hard to complete tasks. This can be frustrating for both you and your child, but understanding the root cause is the first step to finding solutions. With the right strategies and support, you can help your child navigate these challenges and improve their focus over time. Now, let's talk about the H in ADHD hyperactivity. Children with hyperactivity often seem like they have a motor that never stops running. They might fidget constantly, squirm in their seat, or have trouble playing quietly. Impulsivity often goes hand in hand with hyperactivity. This means your child might blurt out answers in class, interrupt conversations, or act without thinking about the consequences. They might also have difficulty waiting their turn, leading to frustration for both them and others. Again, it's crucial to remember that these behaviors are not intentional. It's not that your child is choosing to be disruptive, it's that their brain struggles with impulse control. With the right support and strategies, you can help them learn to manage these impulses more effectively. If you recognize some of these signs in your child, it's essential to seek professional help. Start with your GP, who can refer you to a specialist like a pediatrician or a child psychiatrist. Diagnosis involves a comprehensive assessment, considering your child's behavior at home, school, and in social settings. They'll look at how long these behaviors have been present and how much they're impacting your child's life. Remember, getting a diagnosis isn't about labeling your child. It's about understanding their needs and accessing the right support to help them thrive. It's like finding the missing puzzle piece that completes the picture and allows you to move forward with clarity and confidence. Section 6. Treatment options, support for your child's needs. So, you've received a diagnosis. What's next? It can be overwhelming, but remember, you're not alone in this journey. The good news is there are various treatment options available in the UK for children with ADHD. These options are designed to support your child's unique needs and help them thrive. The most suitable approach will depend on your child's individual needs and may involve a combination of therapies. It's essential to work closely with healthcare professionals to tailor a plan that works best for your child. One common approach is behavioral therapy, which focuses on teaching your child practical skills to manage their inattention, hyperactivity, and impulsivity. This type of therapy can be incredibly effective in helping children develop coping strategies. They might learn techniques for staying organized, completing tasks, and controlling their impulses. These skills can make a significant difference in their daily lives, both at home and in school. In some cases, medication may be recommended alongside therapy. Medication can be a valuable tool in managing ADHD symptoms, but it's not the only option. Stimulant medications like methylphenidate, also known as Ritalin, can help improve attention and focus. These medications are often used in conjunction with other therapies to provide comprehensive support. It's important to discuss the potential benefits and side effects of medication with your child's doctor to make an informed decision. Remember, the goal is to find the best combination of treatments to support your child's growth and well-being. Section 7. Parenting a child with ADHD. Strategies for success. Parenting a child with ADHD can be challenging, but it's also incredibly rewarding. While there's no magic wand, certain strategies can make a world of difference in managing your child's behavior and creating a positive home environment. Structure and routine are your best friends. Establish clear expectations and consistent schedules to provide your child with a sense of predictability and security. Break down tasks into smaller, more manageable steps and offer plenty of praise and encouragement along the way. Remember, discipline should be about teaching, not punishing. Instead of focusing on the negative, try using positive reinforcement to encourage desired behaviors. Celebrate your child's successes, no matter how small they may seem. Section 8. School life. Working with educators for your child's well-being. Open communication with your child's school is crucial. Share your child's diagnosis and work together to create a supportive learning environment. This might involve classroom adjustments like seating your child near the teacher or providing them with extra time to complete assignments. Some children with ADHD benefit from an individualized education program. This is a tailored plan that outlines specific learning goals and support strategies to help your child access the curriculum and reach their full potential. Remember, teachers are your allies in this journey. By working together, you can create a positive and enriching educational experience for your child. Section 9. Early intervention. A brighter future for your child. Early identification and intervention are key to helping children with ADHD thrive. The sooner you seek help, the sooner your child can access the support they need to manage their symptoms and develop essential life skills. Remember, ADHD is not a life sentence. With the right support, encouragement, and understanding, children with ADHD can lead happy, fulfilling lives and achieve their dreams. Your love and support are the most powerful tools in their journey.